My name is Terry Weaver, and I'm from Renton Regional Fire Authority. I'm a firefighter EMT there. Today I'm going to be teaching you about EMS PPE, which is protective personal equipment, and how to protect yourself from infectious diseases. Okay, I'm going to go ahead and pass around a class roster. If you could just put your name, sign it, and then at the end of the class we have a little test that we're going to take, so it'll either be a pass or fail. Just a short little quiz, and then basically a little a task sheet to make sure that you are able to properly put on and take off EMS gloves. A couple housekeeping items. The restrooms are located in the back, so if you need to use those at any time, go ahead and get up and do that. And the exits, thank you. The exits are also in the back. As far as your cell phones, if you can go ahead and silence them, that would be great. But if you need to take a call for work or anything like that, just go ahead and step outside. Okay? Our objectives of this class is understanding the importance of PPE, properly donning and doffing EMS gloves, and properly disposing of them also. So during this class, I'll be teaching all of those things. And like I said, we'll also go through a skill sheet so that you can make sure you're doing that properly. So the first thing we always talk about, and I know you guys have been in EMT classes before, is BSI Scene Safe. That's always the first thing. BSI standing for Body Substance Isolation, and obviously checking to see if the scene's safe, right? So our first defense is making sure we're safe with our gloves, our goggles, right, on every single call. And then making sure that we're not putting ourselves in danger or our crew in danger. Don't get in that tunnel vision where you just have your blinders on and you're not aware of anything else going around you. So always keeping your head on a swivel and making sure that at any time if you guys need to back out of a call, that's an important thing to do. Okay? So let's talk a little bit about personal protective equipment, okay? And number one, eye protection, right? Goggles on every single call. I know you're wearing glasses, and that's an acceptable form. If you don't wear glasses, then you should be putting those goggles on. I know this is not common practice for everybody, and sometimes you can see other people aren't doing it. So be an example, set the example, so that people who follow you will see that you're wearing them on every single call. When we go to take a blood sugar, you have a little tiny stick that goes in, and you go to take the blood sugar. That can act as a little tiny diving board and flick that blood up into your eye, and now you're exposed to something that you're unsure of, okay? So keeping that on, obviously there's a lot of other things that can get into our eyes also. And then we have our gloves, right? Every single call, every time. And I think that you'll see that straight across the board for people. They'll always be wearing their gloves. The goggles are a different story. So the gloves are always worn. They're going to protect us from any sort of bodily fluids, and making sure that they are free of holes. And if you get any sort of tear in them, you take them off and replace them right away. Okay. So being aware, if you've, I know I've been even just moving patients and have had my gloves rip on me before. So be aware of what's going on there. Gowns. Obviously, if you're coming into a trauma scene or even some sort of childbirth, gowns are an appropriate thing to keep our uniforms clean, okay? If you get something on your uniform, then go right when you get back to the station, make sure that you're changing that out and getting it in the wash right away, okay? And then the last thing are masks. And masks can help with any sort of splashing fluids. So we're also talking about trauma, we're talking about childbirth. But another really great thing that masks are used for is you can actually put them on the patient. It can help prevent the spread of airborne diseases like tuberculosis and things like that. So instead of putting them on us, if the patient will be able to handle it, putting it on them so it can keep, if they're coughing and things like that, the germs are away from you. But also putting it on yourself. Okay, so the four things that we have, once again, are the eye protection, the gloves, the gowns, and the masks, okay? So like I said, there's going to be a quiz at the end, so just be aware of some of these things that maybe might be on a test at the end, okay? Hand washing is absolutely the single most important way you can prevent the spread of infection, okay? I've seen it lots and lots of times where people get back from a call and they just go right into the station. And now they've touched every single doorknob, they've touched every, pens, any different sort of things. And now whatever was on their hands, they are spreading it all over. These are not, they're not foolproof. And once you put your hand in here, your hand gets really moist, which can also create just a great breeding ground for germs, okay? So hand washing, number one. Before, after, I wash my hands numerous times during the day, okay? Most contaminants can be removed from the skin with 10 to 15 seconds of vigorous lathering and scrubbing with plain soap, okay? So I'd use soap and warm water. I would definitely go, the first 10 to 15 seconds, obviously really scrubbing vigorously, and then making sure you're doing a full minute of hand washing, okay? And not just your hands. Remember, you can get stuff on your forearms. These gloves are only getting, right up to here on us. So really making sure that if you need to, you scrub up to your elbows or even further, right? So make sure you're getting everything off. And if you don't have access to soap and water, you can temporarily use hand sanitizer, okay? Make sure to wash your hands as soon as you can. It does not replace soap and water, okay? Another thing I see all the time, we have it in our rigs. We have the little spray foam, right? Where then you get back on the rig, you take off your gloves, and you put the spray foam on. And then I see guys get back to the station, and instead of stopping at the sink to wash before they go in, they just walk in. And now they haven't really done a very thorough job of making sure that their hands are nice and clean. So make sure once you get back to that station that you go ahead and use that soap and water, okay? All right, so as far as proper glove on and off, number one, you want to select the appropriate size for your hands, okay? I have 3 different sizes here, small, medium, and large. And so make sure you choose the right ones for you, okay? When you're putting your gloves on, and you really want to make sure that they fit pretty nice and snug, okay? Because when you're doing blood sugars and different things like that that are going to require that dexterity, if you have too big of gloves, it really is going to be an issue, especially, putting Band-Aids on, things like that, okay? So first, selecting your size. Then the next thing you want to do is when you put them on, you want to make sure there aren't any holes in it, okay? And if you happen to have maybe a small cut or something like that on your finger, go ahead and put a Band-Aid on it. Okay, you're going to have to replace it quite a few times during your shift, but I like to do a little extra coverage. So I put a Band-Aid on any sort of cut I may have, and then I go ahead and put my glove on. You can also double glove, right? So you could put 2 gloves on if you wanted to do that, okay? But so now you have your gloves on, you've selected your size that you want to use, and you have your gloves on, and you've made sure that there is absolutely no holes or tears or anything like that. Like I said, if you do encounter that, we take them off, put a new pair on. And even during calls at times, you may have to do that. I know before, if it's been a trauma call and I have, a lot of blood on my hands, I'll go ahead and take my gloves off and put back on a new pair if I'm going to do something else, okay? So the first thing we're gonna do is you go ahead and you use your gloved finger to go ahead and pull the cuff up and down, just like this. So we're not touching the inside, right? Because right now, if we've used these on a call, we have any sort of infectious diseases on here, we don't want it to come in contact with our skin, okay? So we're gonna go ahead and grab the outside of the glove, right? Okay, and you're gonna go ahead and pull it down and out just like this, all right? And then this glove gets wrapped up into the other glove. Okay, so now we have this hand's free, right? And this is nice and clean. Okay, So then what we're gonna do is place one finger underneath, because now we have this, we don't have anything on this hand, right? So we're gonna go ahead and place that underneath, and we're gonna go ahead and pull it all the way down, okay? And now all we're doing is touching the inside of the glove. And then we're gonna go ahead and dispose of this properly, whether it be in the garbage or in any sort of biohazard, all right? What I'm gonna do now is I wanna go ahead and show you a YouTube video that we can view here. Let me just turn this around for 1 second. And you can watch this for a few minutes, and then we will practice it ourselves.
Removal. Follow these steps to prevent the spread of pathogens. Pinch the first glove at the wrist and pull down, touching only the outside of the glove. Ball up the removed glove in the palm of your gloved hand. Slide an ungloved finger inside the other glove, touching only the inside with your ungloved finger. Peel the second glove off inside out, trapping it in your palm. Discard the balled up gloves in the proper receptacle. Clean your hands with soap and water or alcohol-based cleaner.
Okay. So notice that also said that you can clean with that alcohol-based cleaner, which is fine, but we want to make sure that we're also using that soap and water if we have
The medical assistant must wear sterile gloves to perform.
if we have no other option at the time. Okay. All right. Just get back to where I was at. Okay. Does anybody have any questions about that video or any questions on anything as far as we've gone here?
You put 2 fingers on it instead of 1, is that still okay?
Yeah, that's fine. You can put 2, you can put 1. The most important part is that we're not touching the outside of the glove with our bare hand. We don't want to get anything on it that might be contaminated on these gloves. Okay? All right. So we're going to go ahead and we're going to practice. I do have a task sheet that I want to show you guys just so you can review it. It will be at the end when we take our quiz. After you're done with your quiz, you'll then come up. You will go through putting your gloves on and taking them off, and then I will also sign you off on that. So here's the task sheet, and then we'll go ahead and pick whatever size gloves you need, small, medium, and large. Just need 2. All right, perfect. Go ahead and put on another pair, and we can go through it together. And first, when we're putting them on, what are we inspecting for?
Any holes?
Any holes, any sort of tears, or anything like that, right?
Mm-hmm.
Okay. We'll wait for Cameron to get his on. Perfect. All right, so let's go ahead and I want you guys to hold up both your hands and then show me how you're gonna go through removing your gloves. Perfect. Pulling them down. This goes into that hand. And then we're using one finger to slide that down, up and over. Perfect. And then we're disposing of that properly, whether it be in the garbage or a biohazard. Excellent, nice job, you guys. All right, so what I'm gonna do now is I'm gonna go ahead and pass out this quiz. You guys can just write your name at the top. When you're done, go ahead and come up and I will also fill out your task sheet. So before I taught the class, I went through and made sure that my audiovisual equipment was working. Everything went fine there, and I will go ahead and grade the students' quizzes, and then I will make sure that they get credit for the class. And that's the end of my presentation.